It's going to be focused on transforming your data into impact. And we have Andy Krakow, who will be presenting to us and discussing with us as we go forward today. I'm really excited. Worked with Andy previously at one of his former incarnations at the California Healthcare Foundation. So I'm excited to have Andy be talking to us. We've been talking a lot about data and systems over the weeks and months that we've been doing this. And one of the things that's obviously really important is, so what do you do with all that information when you get it together, and how do you make arguments and discuss it? So we have an opportunity here today to hear a little bit about that from Andy. We're excited about that. Just a few housekeeping notes here. Everybody's been on webinar, so go ahead and use your, if you can get on to Zoom, you'll be able to see the slides. We will be posting them along with a recorded copy of this webinar on the NIC site, along with all of the others. So if you've missed any of the others, you can by all means binge watch them over the weekend. We do want to, as much as possible, engage people in conversation. And I hope today's presentation will present itself and allow for conversation and discussion and commentary. So we have a couple of ways of doing that. There's a chat box. If you are new to Zoom, if you can find the chat, if you can find the navigation bar, you can just see where it says chat, and you can put a question in there. You can raise your hand as well. And in the last resort, you can just break into the conversation if you're overwhelmed with something you want to say. And as always, it's a little awkward to join a conversation online. So what I suggest people do after they comment is just to wait a few seconds and listen, and then just jump in. And if you talk over somebody, just keep going, or just follow up on the next person there. Also, if you're just using a phone line, you can unmute yourself or mute yourself by pressing *6. And that *6 will unmute you as we go forward. Sometimes it's a little complicated for that. As I mentioned, we'll be recording this. And if you have not yet signed up for the Hub, please do so. You'll get announcements on there, and you'll be privy to a community that is continuing to grow and provide lots of interesting things for you to learn about this interoperability world. Our agenda for today is we're going to do, like we've done in the past, is we're going to do some rapid fire introductions for new people on the call. After we've gotten here, it's really always interesting to hear who's on the call. And what that is looking like is really sort of name, rank, and serial number, kind of what you do, where you're at, and what organization you're with. Really try to keep it quick if you can. I know there's a number of people on, but it's great to hear your voice and to hear where people are coming from. There's 2 slides on NIC background, and just to give you a context, because we always have new people on the call here. And then we'll spend the bulk of the time, most of the time, with Andy, talking to us a little bit about transforming your data into impact. And so with that, we're going to get started. The way we do the introductions is for folks in the who are new to the call here. Just type your name into the chat box, and what I'll do is I'll call on you, and then you can again make your quick introduction, and that's the least chaotic way that we found to accommodate new people on the call here. So go to the chat box. Okay, Richard, great. So we'll start with Richard, and others just put your name in there, and we'll call on you as you come up.
Good morning. Thanks, Daniel. Rich Connect. I'm a consultant and trainer with the Integrated Human Services Group. I work with the Department of Social Services and counties here in California to implement systems of care.
Excellent. You got extra points. Succinct, to the point. Excellent. Nice. And you've got the video on. So the trifecta, Richard. Thank you. Claire Peters. *6 if you need to.
Hi, this is Claire Peters. I'm an epidemiologist at Children's Hospital Colorado and helping to build out a social care network here at the hospital.
Fantastic. Welcome. Jennifer Dennis. Okay, Jennifer, as you're looking for the unmute button, let's go to Penny Barley Bowers. Trouble unmuting, I think.
I found it. This is Jennifer Dennis, actually.
Hey.
Hi, brand new to Nick, and I'm not even sure if that's how you say it. I've only seen it in writing, but very inspired by the goals of the organization, wanted to be included. I'm a graduate of Johns Hopkins School of Medicine, clinical informatics, and I work for a company that specializes in healthcare integration. So I wanted to learn more.
Well, I hope that you know Harold Lehman. He's a good friend of ours. And I'm
yes,
sure
absolutely.
Went through informatics, so you couldn't get away from Harold there. So
no, I wouldn't want to.
Great. Penny, are you unmuted yet?
Yes, I am. Hello. Can you hear me?
Hey, welcome. Yes.
Thank you. Hi, I'm Penny Brierly Bowers. I am a research fellow at the Guardian Community Trust. And at the Guardian Community Trust, I do things such as build tools that we use to develop registries, that type of thing, work with court systems, a lot of different applied research and programmatic research. Additionally, I am a consultant, and I've worked at the state level doing things like expanding Medicaid, integrating IT systems, that type of thing. It's wonderful to meet you all.
Thank you. Welcome, welcome. Gatson Garay, if I messed up your name, I apologize. Okay. Try the *6. Hello. Okay, we'll move on to Michael Irwin.
Hi, can you hear me?
Yes, got you now.
Hi. So I'm Michael Dahmer Irwin. I'm the Quality Improvement Manager for the Arlington County, Virginia Department of Human Services. I'm working on enhancing data system interoperability to improve service outcomes across our integrated human services system, which includes behavioral health, physical health, and economic supports. And this is my first call.
Fantastic. Welcome. Let me just check. Gatson, are you on or still muted? Okay, Kim Magoon.
Hi, my name is Kim Magoon. I work for a public consulting group. I'm a research analyst with the evaluation team, and we specialize in state-level substance use and child welfare research.
Welcome. Thank you for joining. Matt Henry. No, Matt Henry. I think we're having challenges with people on their unmuting today.
Sorry.
There
yes,
you go.
I did the video, but not the mute. Yes, I'm Matthew.
Hey, you got double.
I'm the CIO at Child Care Aware of America. We lead the much of the child care work across the 50 states here in America.
Excellent. Welcome. Thank you. Kate Cordell. The trick is both on the phone and on the computer there. Okay, let's move on to Layla Espinoza.
Yes, this is Lila Espinosa, and I'm from UCLA, and I support communities using population level data to support their ecosystem change efforts to promote child well-being.
Okay, great. Mark.
Hi, this is Kate Cordell. Can you hear me now?
Yes. Hey, Kate. Welcome.
Okay, thank you. Yeah, so I'm Kate Cordell. I am a consultant to California, work with Richard Connect as well. I have a passion for translating research into practice and making meaningful use of data.
Awesome. Terrific. Now, is Mark there?
Yes. So Mark Needle, and I am in Miami-Dade, Florida, and do policy work for education for the school district, and also a collaboration of all the major early learning providers and institutions that impact them. We're working together to develop cross-system data and visualize that as well.
That's fantastic. Great to hear. Glad to hear we're having Southeast on the call today. We got a lot of West Coasters, so welcome. enjoying the sun down there. Maura, hi, Maura.
Hello, hi, my name is Maura Keeney and I'm with Collaborative Communications out of Washington, DC. And currently working on some data sharing projects, one with the Data Funders Collaborative around creating some communications tools. So interested to hear today, keeping an ear out to how it can help communicate better some of the great work that's going on.
Welcome, that's great, thank you. Aislinn Turner. Okay. Okay, well, we'll move along to Jessica Scullin.
Hi, I'm Jessica Scullin. Aislinn and I both work for the First Responder Network Authority.
Oh, great.
We are tasked with developing a broadband system for first responders. And Aislinn and I are both on the business operations team and responsible for collecting feedback from users and being able to sort of display that data both to leadership and back to our contract.
That's fantastic. Great. Welcome. Margo.
Hi, I'm Margo Heaven. I am an analyst working with ASTA, which is the Association of State and Territorial Health Officials. And right now we're working on a couple different projects with data sharing in the community, and then also working on the Digital Bridge project for electronic case reporting.
Welcome, welcome. Lorri Scott.
Hi, I'm Lorri Scott with the Colorado Department of Public Health and Environment, and I'll be working on a project. It's the Colorado Healthy Hospital Compact, analyzing data from that.
Oh, great. A lot going on in Colorado these days.
Mm-hmm.
Excellent. Jiju Joseph.
Hi, I am Jiju Joseph. I am from Kentucky Commonwealth Office of Technology, the Chief Data Officer's office. I'm an enterprise architect here, and I'm first time here on NIC. My boss, the Chief Data Officer, is out today, and he sent this invite to us. And we are working on various projects. One of them is the integrated data system, and another one is a secure data enclave. The idea is to bring in data from various administrative systems and link it and use it for research purposes.
Excellent. Well, you're home then. We're talking about a lot of those things, have been and will be going into the future.
All right, thank you.
So thank you. I think I got everyone. A couple folks are having trouble unmuting or microphone's not working. Anybody else want to say hello that didn't call on? Now would be a good time to jump in.
Hey, this is Mary Kate Molman. I'm from state of Vermont, the Department of Vermont Health Access, the Blueprint for Health program. And Vermont is also working on developing more integrated data. And as a health services researcher in my role, I'm very interested in how do we apply that data, turning it into information, and then working with programs to figure out how to implement and use that data.
Excellent. Great. Wonderful. We've got all four corners. Anyone else? Last person? Last choice?
Yeah, this is Randy Browning calling in from Cognosante. Glad to be on the call. I've spent over a decade working with state Medicaid programs in the MIDA community, and we continue to help HHS programs, share data for business outcomes. So look forward to the discussion today.
Fantastic.
Hi, this is Lisa Watanabe in Seattle, working at Healthier Here, and we have the Accountable Community of Health contract, part of the Medicaid Transformation Project, and we are currently working on community information exchange. So, trying to look ahead to the type of visuals we want to create with the data that will be collected.
Fantastic. Thank you, Lisa. Welcome. So let's move on to, as I said, just a brief overview of the NIC, and then we'll dive into the topic where you all come to hear from Andrew today. So just briefly, since there are particularly a lot of new people on the call here, which is great, welcome. I love hearing where everybody's from, what everybody's doing, and just building this community, which is just wonderful, and it's been very gratifying to be able to help bring people together around all these complicated topics. So the basis for the NIC, or the National Interoperability Collaborative, is really about building a community of networks. It's about bringing people together across, both from within and across multiple domains. And we've heard today, we've got folks from health, from education, from human services on the call here and other places. We focus on, as we describe the world in terms of domains, these are kind of just general categories, but we think about the world in terms of social and human services, which is obviously a lot of different programs, public health, education, public safety, emergency medical response, and healthcare and IT, which describes a lot of the universe. And what we are attempting to do is to bring those domains together on these calls and then begin to facilitate the cross-domain kind of conversations, both online during the conversations, during different webinars, but also online on the system itself, on the NIC Hub itself, where we will be moving more and more into these cross-domain kind of conversations, which I think are particularly interesting and particularly relevant given where we're at today in terms of value-based payment and the urge to really make interoperability all the more interesting. And last but not least is the whole area of social factors affecting health. I was at the Office of the National Coordinator meeting earlier in the week, as were a number of other people here. And it's amazing to hear the focus on both value-based payment and on social determinants. So it's now resonating all across the federal government, state and local. And I think that underlying all of this work, all this cross-domain stuff, it really has a lot to do with social factors and making sure we're able to connect across and within those domains. We've summarized some of that work we've done on this paper you'll see off to the right side in the nick of time. A couple of years ago, we wrote this for HIMSS, and it kind of describes some of the similarities and differences between those domains. I encourage you to find it on the website, and we'll be focusing more on that. I wanted to just offer one more thing, and we just briefly here, is Stewards of Change, which is the organization for the NIC, has been working on a training program to try to help communicate this work around interoperability and cross-domain sharing, and we call it the Interoptimability Training Curriculum and Certification. And we've been at it for a little while, but we're getting ready to actually launch that, launch the first couple of modules in the beginning of the year. And there will be a series of modules that will be coming out over the next couple of years for sure. And it's the attempt to try to socialize a lot of these complex concepts in a way that people can learn and share both individually and within organizations. And what we'll be doing is we'll be putting out a call for some reviewers pretty soon to ask people who, small handful of people who would want to review it, take the first couple of modules, and participate in the little bit of a feedback mechanism for us, and to get some feedback from that. So keep tuned to the NIC website, or my email is right down there. You'll be hearing more about it. And if you have interest in subjecting yourself to it, we would appreciate it, and there'll be some benefits to that as we move forward. So stay tuned. You can see more about that on the website as well. There's a short video. But I just wanted to put it out there for folks who are interested in training and education around these particular topics. We're going to be contributing to that body of knowledge. So with that, I think we will now move smartly into the session itself. And again, Andy, welcome to the call today. I had the great fortune of meeting Andy a number of years ago when we were working in California, helping the state stand up its open data portal. Andy was the program officer at the California Healthcare Foundation, and we just had a great opportunity to work together to try to do something really new and different. And that was really I think in my mind, the origins of what do you do with the data? How do you collect it. How do you bring it out there into the community for usage in all sorts of different ways? And I was fascinated with that, and Andy has gone on to really focus in on that since he's left the foundation in a variety of different areas. And under his current consultancy under Hillcrest, he's been focusing and concentrating on that, really helping people to do that in a whole variety of ways. So we have the great pleasure of hearing from Andy, his experience both as a journalist, as a foundation person, and now as in the world of consultancy. helping people learn how and what to do with their data better. So Andy, with that, I'm going to, we're going to do a little bit of a, I'm going to stop sharing my screen. Andy, you're going to pick up yours. Sure. And we'll, hopefully this will work perfectly fine.
Here we go. Let's see if we'll see if we can make this transfer.
Okay, well, we got your face, there you go. And
good.
Perfect, there you go.
All right. Those were wonderful days, Daniel. It was really exciting when we were working together on open data. It's amazing to think how far both California and the whole movement has matured, the open data movement over, I think it was 2014 or so. I think is when it, maybe 13 or so when it launched, but very exciting. And it was great. I'm glad you took the time, Daniel, to let people introduce themselves. It's very helpful for me and just really exciting to hear what people are working on and the amazing array of domains from which you're coming at this work. This notion of taking data and transforming it into impact, it's one of my favorite topics. I think it's something that we have perhaps collectively in the social sector not been as successful as we could be, and that's why I jumped at the opportunity to both be able to think about this in preparing these presentations and then to share some of my thoughts on it, which is what I'll be doing right now. Daniel already gave me a pretty good introduction, which I really appreciate, but to summarize, in essence, I'm a data storyteller, I guess. And the work that I do in data storytelling is what I like to do is I like to take data that organizations collect and I help them communicate their findings in order to reach the people who can do something with this information. And you know, why do I like to do this? I guess my abiding interest is this notion of combining data and combining it with stories with a notion of changing mindsets so that we can achieve social change. And this consultancy that I established it about a year ago. Its aim is to pursue just this. So that's what we're up to. And I'm just going to pause just for a second. I'm going to see if I can find where, if you don't mind me looking at my desktops here, because the box that shows the where you guys are all going to put in hopefully your good notes when you ask me questions, it has mysteriously disappeared. So let me see if I can find it again. Hold on one second.
Sometimes it's at the very top. Sometimes it's at the top of the menu bar. It kind of gets hidden. And yeah, then what we'll do, Andy, if you're not finding it.
Go on, Daniel.
I'm saying if you can't find it for some reason, we'll be monitoring the chat box on Sundays. We'll be monitoring it, and we will interrupt as appropriate to bring those questions forward. Okay, so
okay. What I'm going to do is I'm going to put it now in my lower screen and see if that does the trick. So let me start to share again.
Okay. 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 Yep.
Okay. All right. So everyone can see this okay still?
Yes.
Okay.
You're good.
And alas, I can't see the chat box, but oh well. So thank you, Daniel, for that offer of of showing, being able to, point it out to me when people are coming in with questions. And by the way, please feel free to just interrupt me whenever. I really do not mind that at all. But let's dive in. In order to understand, I think, where we're at now and how we can make improvements in visualizing data, I thought it'd be helpful to talk about the historical context to social sector data visualization. And so let's dive into that. Oh, now I can now see my comments. So perfect. So let's dive into this. And I'm curious if I start. Let me go back here. If I start here, I'm wanting to understand if people know what this is. Any thoughts on what this could be? Or
it's
not what it is. The significance of it, I should say.
I was going to say I thought it was the beginning of Brexit, but maybe not.
It is actually kind of timely for today, isn't it? I hadn't thought about that.
It's something increasing over time.
Yes. So what this is, and by the way, whenever I show this, it's unusual that people will actually know what this is. This, as it turns out, is the first published bar graph. William Playfair in the 1780s, who had quite a career because not only did he create the bar graph, he also created the pie graph and actually the line graph as well. But there is a point in time when we can look at this and say, data visualization began here. Now, yes, people could have been doing stuff before this time, but this is an interesting marker. This was for an atlas that he was doing, yes, about exports and imports from Scotland. So let's move on because there's other ones that I want to show as well. Some people are familiar, I think, with this one that I'll show next. Can anyone identify what this one is right here? Does it look familiar to anyone? I can tell you.
Yeah, in London when they
Jon
first
Snow. Jon Snow.
Very good. That's right. I heard London, I heard Jon Snow, and both are correct. In I think it was 53, there was a cholera epidemic in London. And at the time, people thought it was bad air that was causing cholera. And Jon Snow realized that it was water. And actually, in particular, this pump that's on Broad Street, it's actually still there. But this is a pump where people were collectively going to get their water. And he realized that the houses, those are the more dense blocks that you see there, were the ones that were most affected by cholera, and so determined that it was water, not bad air, that was causing cholera. Father of epidemiology, but he also, in essence, kind of changed how we look at, in this case, data as a map. So really instrumental in so many ways. And the last one I want to show, this one's from the 1940s. This is an infographic. And maybe we think of infographic as something that's relatively new. Perhaps, they started when USA Today started, some people may assume, or something to that degree. But this appeared in Fortune magazine in April 1941. And, although the illustrations look a little different now, and obviously the subject matter is different, it's not something that, we'd be used to seeing something like this today. So the point here is that we've been doing this work in data visualization for some time now. But what comes to mind is that we have not really turned that corner, I think, like I said initially, in terms of making these data useful for impact. And I like to sometimes think of data as iron ore. We're often focused on the amount of data. We want to mine a lot of iron ore, in essence. And in the context of the world of interoperability, we're talking about large mounds of raw and hopefully, albeit, integrated data. But raw data on its own doesn't do much for us. Like iron ore, it's not going to be useful until you turn it into steel. And maybe you can think of steel as the data equivalent of information. You want to turn data into information. But steel, like a steel rod on its own, doesn't do much good. To me, the goal is not to turn iron ore into steel. The goal is to turn iron ore and forge that steel into, say, a hammer or a building, or something along those lines. By that same token, we need to transform our data not into information, but into action, into the tools that we can create. And part of doing that is all of these kinds of things, which I'm going to share now on some of the lessons that I've learned in terms of how you can communicate these data effectively. We'll go through 11 lessons. I'll keep a monitor on the time because I certainly don't want to go over. And so I might, if I need to condense, I will. But you will have all the slides available to you after this. And I'll provide my contact information at the end too, in case you want to see these, anything that I may have missed. The first one that I want to talk about is really, these first lessons, is really about the craft of visualization. And there is a craft, as you probably know, into making visualizations that are useful and clear. So let's start out here. And this first lesson is that the type of chart you choose, it really, really matters greatly. And I'm going to pick on a chart that in the data visualization world gets picked on a lot. It's a pie graph. And I'm going to pick on it for a particular reason. So take a look at this. And I'm curious, does anyone know what the biggest slice of this pie is? And again, you can shout it out or put it in the comments field, the group chat. Any thoughts about what the biggest slice is?
Hello?
And it's fine if you tell me it's kind of hard to tell.
Yellow.
I see some people putting the mustard, yellow, yellow, yellow. Ooh, a lot of yellows. Okay. I think you're probably right. But my question to you is whether it's easier to look at these data and to tell what the biggest slice is, or the biggest amount is, by looking at it as a pie graph or the bar chart. There's a cognitive processing problem that we have with pie charts. It's actually much easier for us to view information as vertical bars. It's just the way that we process information. And again, my point here isn't to pick on the pie chart. Yes, there are instances in which a pie chart can be very effective. When you have a lot of disproportionality, when you only have a few number of slices of a pie, and you probably, though, shouldn't be putting 2 or 3 or multiple pie charts together. That overwhelms us. But the broader point that I'm trying to make here is choose the right chart. And I won't go into all of the charts that exist out there except to show you, I've got links here and you can get these, but I want to show you some of these resources. There are many, many different types of charts here. This particular resource lists all the different charts, and if you click on any one of these, it will give you information about what that chart is, how you might use it, etc. So the resources are out there for you to say, what is the type of chart that I should choose for this? What will clearly and in a compelling way express this information the best? Here's some material about when to use pie charts and when not to use. This is what I was just talking about. And another topic that very much relates to the concept of what chart type to use is color. Because color, in essence, when you think about a data visualization, it's kind of filled in lines and filled in shapes of different colors. And so there's some, when you get these slides, you'll see too, there's some information here, a link to some information about the colors you can choose for a data visualization. And as it turns out, gray can be a very important color in data visualization because it's, you can use that as a way, you can use the other colors as a way to, highlight things, and gray can be sort of stepping back from that, the shade that you don't want to highlight. This I'm just putting in here because there's actually a nice poster that you can get created by the Financial Times that nicely summarizes the various types of visualizations that exist out there. So if you're really into it, there is tons of information out there for you. Still on this topic of data visualization and making sure that we craft really good visualizations. When you're creating a chart, I always think it's helpful to create it, then to step back and to say, how can I simplify it? And then step back again and say, how can I simplify it? So I want to give you an example of this very concept. Here's a chart, how people get news by their age. And this is comparing newspapers and the phone. Personally, I created this chart, so I can critique it. I don't think it's a very good chart. I think it's very complex. And I'm kind of curious what others think, and particularly what might make this chart complex. Does anything come to mind in terms of what makes this hard to read for people? Again, comments either way, Zoom chat, too many colors someone put in. Yes, that's what I would point out. Anything else that people notice? The colors have no logic. I very much like that. Not a clear legend. All very true. All very true. Order of the bars seems random. Yep, all of these are really good points. You guys are good. And this, I just saw someone put in the comparison. the comparisons within the age brackets are not easy. Is that the point you were saying? I think that's that. Yeah. And again, I mean, this chart I created probably in a matter of minutes, and I created it because I want to contrast it with this. Now this one I can't take credit for. I didn't create it. It's the exact same information. Interestingly, there are no words here. There's not a single word on this chart at all. And honestly, I mean, I think this does a far more effective job. It doesn't use color. Well, it uses white and, you know, dark gray, but it does not really use color. It also stacks the two charts. That's, you know, rather than putting them side by side, it stacks them. Really nicely done. And it conveys the point so nicely. And this is probably the simplest chart that I've ever seen, which is why I wanted to try and recreate it as a very not simple chart. So that's this one, and maybe someone was putting in here, you know, that there's no label. I have no idea what it needs. It needs a title, and all of that is very true. There is some ambiguity here, but I think there's also the point here is that you can create very simple charts with a minimal amount of words, or with using your words strategically. You know, what I might add for this one, for example, is rather than a generic chart title, I might add in a headline that summarizes the results. But the overall message here is don't forget to simplify. It can be really important because your users are not going to probably spend a lot of time on your chart. There are many other lessons that I could go into regarding the craft of visualization. But there's a lot of ground we want to cover, and I want to talk as well about next. I want to talk about data storytelling, which is sort of, it's one of these words that gets thrown out around a lot these days. And so because of that, I wanted to just share with you some examples of data storytelling. And actually, as we go through the other lessons, I'll be diving into these and showing them to you, some of these live on the screen. But just to give you a quick overview, a data story is not one thing. A data story can take a question and answer approach where you're sort of guiding people through the content by asking and answering a series of questions. It can be a long form story like a journalist might write that incorporates some data and really sort of humanizes that. A slideshow, you know, we'll be looking at one of those momentarily. Slideshow is a very good form of data storytelling. And a few more. An infographic, certainly that could be a data story. At the very end, we're going to look at a data game, an intellectual exercise that you can play with data. That's a lot of fun. So a data story could be that. And finally, one that I use a lot in the community level work that I do is something called a persuasive narrative. It's basically a one-sheet handout. And the notion is you somewhat quickly identify a problem that a particular person is experiencing, and you provide a solution. Perhaps it's an idealized solution to that problem. And I do this with a lot of health departments. But you provide the data to generalize that person's problem. And this is not meant to be long. This is, like I said, a one-sheet handout. So data story, I wanted to provide this just to give you some background. Are there any other types of data stories that you think I didn't cover that come to mind for you? I'll take a minute to pause and just see if you have any questions or thoughts on what other data stories could be. Well, I hope what I put might have been exhaustive. I don't know, but you know, videos. Oh, that's a good point. Someone just put in videos. I did forget about that. Yeah, there are some really wonderful data stories that are completely videos. And someone else mentioned qualitative data, so that as well. So yes, I mean, when you hear the term data story, I don't want you to think it has to be just one thing. The idea is that there can be many different types. Someone else just put in an interactive tool, and another one put in micro simulation. So yes, lots of different things. To me, often, when I think about data story, in my mind, I often think about humanizing the data. I think about attaching it to a person. And that kind of gets to the point that I want to make here is why should we even bother with data storytelling? I mean, you know, haven't we heard that a picture is worth 1,000 words? Isn't that true? Doesn't a graph alone want to do the trick? And I don't think it will. Our brains are wired for stories. If I were to start something and say, let me tell you a story, you are going to start to pay attention. Your brain's going to be primed in a way that it wouldn't otherwise be. And not only are the language processing parts of our brain activated when you start to tell a story. Let me tell you a story about Jennifer. She suffers from asthma, you know, something like that. But the other areas of our brain that we would use when experiencing the events of that story, they're also activated. So it's like a story puts our whole brain to work, and it really gets us primed to pay attention to the material. I'm a fan of combining data and stories. Stories serve an important purpose, like I was just saying, but we also need the data for the intellectual side of us. We need to be able to paint the data on a broader canvas that can include photos, poignant quotes, and things along those lines. The two really can go together nicely, and I'll show you some examples of how that can be done. This I thought was just a nice quote from a pediatrician that I read in an article in the New York Times. Health facts aren't enough. Should persuasion become a priority? Dropping knowledge from on high, which is still the modus operandi for most scientists, it doesn't work. And I think this is a point that, to me, applies to this. You know, facts actually are not all powerful, or at least they're not all powerful to all of us. But I think if you can combine them with stories, then you're getting closer to something that can have Superman type capabilities.
So Andy, let me just pop in here a second just for a question for you. You brought up something that obviously is on a lot of people's minds in terms of facts. And, you know, we've all sort of grown up assuming that, you know, just the facts, ma'am, you know, and we'll make decisions based on that. Obviously, these days, that doesn't seem to hold much currency. So I'm wondering if you have thought about or talked about or seen anything that's relating to the persuasive nature of alternative ways of communicating, like storytelling. Is that a way that can actually get, in a way, introduced to facts, but not have them be, you know, sort of prima facie, so that you're actually able to connect with people and then provide information in a way that is sort of digestible?
Yeah, meaning the digestible information could be the facts. Is that what you mean?
Yeah, I'm just as a way to get into people because you're making a persuasive argument, but not using the facts as a way in, using the story as a way in. Is that more persuasive? Yes.
Well, I think you can do it either way, but I probably would, and by the way, I think I would counsel people probably to pick the approach that they feel most comfortable with. Like if you're speaking to someone, if you're starting a conversation with someone, you may feel more comfortable starting with a fact. But I would try probably and get you to a place where you can practice and start with a story. And actually, I do some of that with local health departments. When I do some of this data storytelling development work, one of the things that I will do is, in working with others too, in this case, for example, working with Accountable Communities for Health in California, is have them do some role playing and say, okay, so you've got this really great story, and now let's imagine you're at the farmer's market and you bump into the manager of the farmer's market, and you got to sort of say something, there's something you want to express to him, and you want to start out with a story. And it feels awkward, it really feels awkward, but if you can get to a place where you can feel comfortable doing that, or if you're in a meeting setting and someone introduces you and, you know, Andy's going to now tell us all about their Accountable Community for Health and what the collaborative is up to. And if you can start out by saying, thanks, you know, before I begin, I want to tell you a story about someone that I recently met. It's just, if you can get to that place, I feel like you've got your audience. And so there are ways to role play with people to help them get to that place.
Thanks.
So obviously you can assume that one of the lessons that I'm going to put in here is, yeah, we should probably be thinking about creating data stories, not just data visualizations. We started with the craft of visualization. Now we're talking about data stories. And I want to show you an example of one that I think is nicely done. It's a really good visualization, I think. It's about America's healthcare crisis. It's probably one that we all think about. And again, you can get the links to all of these in the PowerPoint. What I really like about this is, yeah, this has some really nice visualizations that are clever and, you know, have a lot of animation, as you can see. But what I really like about this is the text along the left side that's narrating this. You know, so what's causing all of this spending? Are Americans engaging in more healthcare activities? And then it's a combination of some brief text and the video, I'm sorry, and the visualizations that really help sell this and make this point. And this is one that you can actually adapt pretty easily. I think it's for those people that may not feel as comfortable with a story about a human, the human story. This is still can be an effective storytelling technique. There was just one, actually just today, I was looking at a New York Times, just did one on comparing coronavirus to SARS and, you know, how, and, you know, they did basically that same approach. They had a series of questions that they would answer and the visualizations helped explain it. Just very nicely done. So this can be an effective storytelling technique. Are Americans sicker than other countries? No, and it shows you. So that, you know, is a form of data storytelling and one that I'd recommend you use. And then as you get a little bit more complex, I guess, with storytelling, and if you feel comfortable with it, I think, yes, it's great when you can start to try and appeal to the heart in addition to the head. And I'll show you an example of this notion of incorporating poignant quotes and personal stories to draw in readers. In this case, I was working on a data story with this was a Rockefeller funded initiative, Rockefeller Foundation funded initiative with a communication firm, Purpose, and they were charged, Purpose was charged with describing the plight, I guess, of people who from week to week don't know what their schedule, their work schedule is. And there were a lot of data that surrounds this. Now, the work that Purpose does is very visceral and raw and human driven. So they had these wonderful stories and collected all this information. And then the notion was, let's try and take this and let's turn this also into some storytelling. So a combination of data here and stories. Starting out with the data, in this case, 25 million shift workers in the US. And by the way, I did this when I was at a digital agency, Valier, a couple of years ago. But then it dives into describing an individual, Rondell. He works shifts at a grocery store. And from week to week, he doesn't know what his schedule is going to be. So Daniel, actually kind of coming back to your question, in this case, we started with the data and led into the story. But like I said, I do sometimes think starting with a story can be really effective. They had a lot of great quotes. So we, you know, from others. And so these quotes, again, they help color the data. You know, here's one coming up here. I think it's this one. You know, yeah, this one who has a hard time finding a babysitter on late notice. I mean, my gosh, we can all identify with this. Any parent can. And so it's this combination of data and stories. Now we get into some more data that really sort of helps, hopefully, you know, make a persuasive case. I won't go through all of this, but as you go on, they even have, you know, they even have recorded some videos from some people. And so we use that as an opportunity, even as we're providing all of this data, to go in and have videos, in this case of Rondell. So this is that notion of data and stories and using stories that are very humanly told, or tell a story about humans. Great. Okay, so we're going to go on now, and this next section is about process. You know, how do you get to the point of creating a visualization? So we'll talk a little bit about that. But first, let's see if we can get this to work, Daniel. First, I have a poll question for you guys to answer. And Daniel, if we can get this working well, he's going to put it up on the screen. There we go.
Okay.
Who do you need to reach with data findings from your interoperability work? And you can choose all that apply. We will give you, maybe 15 seconds or so to look at this. And then we'll look at the results. All right. Should we see what results we have?
We've got a couple more coming in. They're rolling in. A couple more something.
Okay.
Get all the answers if possible. We got about half of the respondents here. Maybe some folks can't respond because they're on the phone. Okay, going once, going twice, and we'll end the poll. Oh, keep going. Another 2 seconds here. People are clearly thinking about this.
Someone asked to state the question again. Who do you need to reach with data findings from your interoperability work? Choose all that apply.
Okay, I'll end, and then Andy, you can share, kind of talk to. Some people don't see the screen because they're on the phone.
Oh yeah, good point.
Go.
Yeah, so let me. It's a nice mix, which is good to see. The highest one was for agency heads or other staff in government departments, elected officials. Actually, I'm surprised that's pleasantly surprised. 50% of people basically saying that. Advocacy organizations, 46%. Researchers, 34%. Journalists, about 1/3. Service providers, 60% or so. My boss, 30%. And funding organizations, of course, 69%, 68%. So this is, the point here is maybe to get you thinking about the fact that you should think about your audiences. You should not only think about who your audiences are, and not only should you think about trying to target, and often when I ask people, as a communication pros often do, is you say, who's your audience? And sometimes people will say, everyone, or the general public, or whoever. No, if you're a communication person, we're going to try and get you to target. We're going to get you to say, well, who, not only elected officials, but what elected officials, at what level, who are they? Because it helps you in the process of putting together content to know who exactly you're trying to reach. And when you know who you're trying to reach, then this is lesson 5. You can go through this step of talking to your users. And when you talk with them, and I don't mean talk with them after you've built it, I'm talking about talking to them before you build something, you can know what matters to them, you can be empathetic, you can walk in their shoes, and you can know how they want this data and this information that you're providing, how you want it organized. Someone asked a really good question here. If there are multiple audiences, do you create different stories? Often I find, in my experience, that you sometimes can use the same story. You might tweak the messaging a little bit different. You might change the display. You might be going, instead of a fact sheet, you might be using a presentation. But it's often the messaging. It's someone put here, speaking their language, that you're going to be changing. But what I find helpful about focusing on a particular audience is it gives you this, you'll start to have a flood of ideas. Like when you start saying, you know what, I want to reach an elected official and I want to reach this particular elected official, you are going to have a flood of ideas in terms of how you present that information. First of all, you're going to be able to meet with them or their staff and have coffee and hear their ideas. When you say we want to reach the general public, it's just so ambiguous that you don't know where to begin. So always talk to your users. And I want to show you a few examples of what you can do when you are in that place where you can talk to your users. So this first one is something that was built actually using open data from the state of California. As in this case, it was data on asthma ED visits across the state. And what I like about this display is, of course, they went and talked to who their user base was. And they said, you know what, we want to create a slideshow. We want this information to be valuable to us and offered in a format that feels like a slideshow. And that's what I think this works nicely as a slideshow. It's a type of display. We showed it before when we were talking about data storytelling. In talking to their users, they understood that this was going to be very useful. And they also did offer an interactive map here that you can change. You can look at it by the data by zip code, et cetera. But more importantly, they offered the slideshow. In a prior job, I worked at the Lucille Packard Foundation for Children's Health on a website called kidsdata.org, which has lots of data about child well-being. And one of the things that we found when we did this, with this website, is when we launched our fact sheets, and these were meant to be printable fact sheets, purposely 2 pages, meaning 1 page front and back. When we sent this out by email, it was one of the most visited emails, and one of the emails from which we got the most action from. And so this notion of understanding who your audiences are and what their needs are, it can be so important in terms of knowing how you want to build something. You want to build for their use case. This brings to mind another lesson that goes right alongside with this notion of, this is in the process section of talking to your users. When you're building a visualization, it's really important to enlist writers and designers and other members of your community to help you craft your data story. There's a quote that I heard from an epidemiologist at a health department in one of the counties in California that I think really describes it. She's a wonk. She's a data wonk, and for her, she was joking a little bit, but she was saying it's hard for her to speak English. It's hard for her what she meant is to translate her data findings into plain English. And it's even harder sometimes to write those data findings in English. And I certainly have experienced that. When I was at the California Healthcare Foundation a couple of years ago, we had these wonderful data on maternity care in California and the quality of maternity care and how it can vary depending on what hospital you're at. I can show this to you online. And what was interesting to us is that we knew we wanted to create this interactive map. We went right to the data wonk side. But we actually brought in a communication person, a freelancer in this case, someone who was outside of our world, and we did that on purpose because we wanted that person to be able to take a look at this and help us come up with a way to present and package and message these findings. And it was her, she came up with this idea of a tale of 2 births in California. And this to us, it just, from there we could put together the infographic based on that. But as a writer, she could come up with this really great notion of, 2 births, a tale of 2 births, and how Sarah goes to a high-performing hospital and how Maya goes to a low-performing hospital. And this infographic, the year that we released this, it was unquestionably one of the most visited publications, if you will, that the foundation released. And I believe a lot of that has to do with us involving others, in this case, a communication pro, to help us put together this information. Let's go on. I think another thing that you'll learn, and maybe you already have, of course, when you think about your audiences, is when you start with a full story, you've got a lot of data, right? And when you start by sharing that full story, your audiences, they're going to be overwhelmed. And it's not a very effective way to say, let me tell you everything I know about this. If you're lucky, the person that you're trying to reach may in college have taken one course or perhaps read one article on the subject in which you're an expert. And so when you exhaust all of the information and share everything you know about it, it's not going to be that helpful. Now, often what I find is that organizations say, you know what, it's really though hard for us to to summarize. And so what I often will suggest is it's an approach called quick depth. I learned it from a work I was doing when I was at California Healthcare Foundation. This was work that a communication firm mentioned to us. And the notion here of quick depth is you basically say, when someone is coming to you for information, I mean, in most cases, they're probably going to be not going to be in front of their computer when they have 15 to 20 minutes to sit down and digest it. So send them something, and don't mind the city of Melbourne, that's just a technical error, don't mind that, but send them to something that's a teaser that can get them interested and engaged, because maybe they're making breakfast for their kid or on the bus commuting to work, whatever it may be. In this case, this was work that I was doing on opioid misuse with counties in California. And this teaser is going to link to a larger fact sheet, a report card that has lots of information about opioid misuse. But we began this with a teaser. How many people died from prescription opioid overdoses in your county? And then you can see your report card. You can still have, in other words, that deep amount of information. I'll just go through. You can see this is a rather large report card. This is a template of it, so that's why you see some places where people can fill in information. But lots of graphs, some maps, etc. You can still have that, but just don't start with that. So think about that notion of quick depth. This idea of adding depth incrementally to what you present. You can start with a graph on Twitter, and that graph can lead to a fact sheet, and that fact sheet can link to the full report, but don't start with a full report. So let's take a look at poll question number 2 while we're on this topic of thinking about process and what our users want. So if you don't mind, Daniel, putting that second question up now.
Et voila.
And we'll give you, thank you. How will you share, disseminate your findings? And you can think about a particular project that you might be working on. So you can make that concrete in your head. Here again, choose all that apply in terms of thinking about how you're planning to disseminate your findings and how you would want to disseminate your findings. We'll give you a few more seconds or so to fill that out. And if you prefer, by the way, to put it in the group chat, that's fine too. All right. Maybe 10 or so more seconds. Someone's putting in, and it's very true, that the channel of communication is dependent on the target audience and the nature of the message. Couldn't agree more, and I'm so glad you mentioned that. It's so important to think about your audiences, and your displays could be different depending on who you're trying to reach. I think we've got a quorum, Daniel?
Yes, we're there.
Good. I am grateful for your responses, because this will be a nice lead-in to the next section. And I'm kind of hoping you'd respond this way. Typically, when I ask people, wherever they are working, they could be working internationally, they could be working on Capitol Hill, they could be working in the state capitol in Sacramento, or they could be working in community settings. More often than not, they will tell me that they want information to be shared in a face-to-face setting. And the choices that I see here that you've answered verify that for me. You're going to be wanting to share this in one-on-one or small group meetings. You're wanting to share this as a presentation at a public hearing, 86% for that. In telephone conversations, there are some digital ones here, no question, by email newsletter, by individual email outreach, 50% through social media. But what I find interesting is that more people are saying that they're going to want to share information in the small group meeting, 90%, than in social media, 50%. You'd think that might run contrary and counter to where we are in our world today. And the point, I think, here is not that we shouldn't be working and thinking about things in a digital way. Obviously, that's really important. But that given our users that we're trying to reach and the use cases that we have, designing for face-to-face is very important. There's a digital arms race going on right now with the data visualization world. Each day, a newspaper, the Washington Post, the New York Times, Reuters, etc., come out with just amazing visualizations that make your head spin and your jaw drop, and I'm a big fan of those. But they're after mass outreach. You know, when you're the Washington Post, you're trying to educate people across the country. What you were just telling me in your responses is that you're going to be doing things in face-to-face settings. So building out that really interactive, amazing display that, yes, is going to cost you potentially tens or hundreds of thousands of dollars, it might not actually match your use case. That simple fact sheet or presentation may. And so this is lesson 8. Who you want to reach may be standing right in front of you, and design for that use case. We talked about, these are some examples of how you can design for that use case. We talked about presentations already. And, you know, fact sheets, I've even heard people use, like, you know, you sit down somewhere and there's a data placemat there. I love that idea. Data posters and murals that appear on the street. And one health department with which I was working in California, they had this great idea. They created this, like, a data gallery. They took posters of findings, data findings, and they made those into nice big posters. And before the meeting, people could walk around the room, and they encouraged people to put Post-it notes on the posters to say, oh, this really, you know, I've got a question, a follow-up question, or wow, I didn't realize this. It was a way to start the conversation. And I love the idea that they thought of these Post-it notes. Again, it's a face-to-face setting. And in that case, the money they spent was to basically take these data displays and make them into posters, which is, I can verify, far less expensive than, you know, hiring a digital agency to build out something that's very interactive. There is a place for those kinds of displays. There is a place for Twitter, but a lot of the times you will be in face-to-face settings.
So Andy,
Okay.
let me just pop in
Sure.
here for a second, grabbing a moment here for those of you. I'm fascinated by this, especially the last thing you said, because as you know, we do a lot of graphic illustration on large posters. And for those of you who are not familiar with their work, you can find it on the website. Then what we say is, you know, if a picture is worth 1,000 words, then a mural can tell an entire story. And what we found over the years is actually graphically illustrating that, and then providing those both in small group and large group settings is incredibly powerful, especially as the world, we believe, is, you know, really digital or visual learners. And it'd be interesting to comment on that a bit. One of the things we did, and if we have time, I'll show it at the very end, is we put together our murals in a gallery like we've discussed recently this year, and have dozens and dozens of these things. And it really, from our experience, really brings people into the conversation in an incredible way, and allows you to have, which I thought was fascinating, is that one-to-one conversation when you're standing in front of something and looking at it together or in a small group. You can actually communicate complex concepts because you've got the visual, and then you can also layer in the data on top of that. So yeah, I think Sunday's has put up a link here for that, for those folks who want to check that out at some point later. But back to you.
That's great. I'm glad you mentioned that. Yeah, it's I'd love to see more of that being done. This notion of data walks or data galleries. This is a links off to actually some material from Annie E. Casey Foundation that they've put together on it. Again, when you get the slides, you can go there. This next and final set of lessons is on making data relatable. And I'll share with you what I mean, because there's I think it's three lessons that apply to that. This first idea is it's really important to be careful with large numbers. They can be abstractions. If I say that 65% of people live in poverty, or 5 million people across the US suffer from asthma, those are, by the way, I don't know, you know, I'm just using those as examples. Those are numbers that mean a lot to you, but they're abstractions to us. We need help understanding numbers that feel large. Paul Slovik's a cognitive psychologist at the University of Oregon who's done some interesting information on this, or research on this. And it's this idea that cognitively, evolutionary, we are sensitized to small changes in our environment. And so when we see big numbers or large changes, it's hard for us to grasp that. And one of the things that I think I've been seeing lately among those news outlets that are doing great data visualization work is how they're trying to address this. And so I want to share with you a few examples. So let me go to the web. This is one that the Wall Street Journal put together on, it was a bunch of years ago, on what are your chances of winning the lottery? 1 in 292 million. 292 million is like, that's like one of those gigantic numbers that it's hard for us to grasp. So as good storytellers, as they are, they led into this by providing some context. What are the odds of winning a coin toss? What are the odds of being left-handed like me? What are the odds of dying in a motor vehicle accident? This one sometimes throws people off. You're going to pass away from something. It's 1 in 112. Now, if you can see it, you can see my scroll bar on the right side. That's all preamble to this. What does 1 in 292 million look like? So let's scroll or jump ahead. And you can see the scroll bar to the right, hopefully. We've just passed 2.92 million dots. It's 1%. Now let's jump ahead to 50%. And now, finally, let's jump ahead to the rarest of the rare, 1 dot in 292 million. It's just, it's a simple visualization. All they did was take a series of dots or boxes and just did a really nice job of expressing this. It's one way in which you can express large numbers. Another way is what Reuters did to talk about plastic bottles. I love this one. We're drowning in plastic. You know, since you opened this page, 400,000 plastic bottles have been used or sold. What I love about this is every hour, you know, the number of plastic bottles is equal, you know, to the Christ the Redeemer statue in Rio de Janeiro. Every day, well, now we're talking about the Eiffel Tower. 1 month, and well, my gosh, now we're definitely surpassed the Eiffel Tower, 40 billion bottles. And again, you're taking these large numbers, billions, and you're making them really meaningful to people. We can start to understand this now. And in the past 10 years, oh gosh, look at that. It's bigger than basically New York City as a whole. It looks like it's burying, is that Brooklyn there? I think it's burying Brooklyn.
Long Island City, you know.
Yeah, there you go. Where Amazon was going
to go.
It's just a very nicely done.
From Amazon.
There's other strategies for doing this. In this case, this was an example of someone taking small numbers to make them more meaningful. They were talking about extinction. So they turned the number of animals that exist for a given species into the number of pixels. So here's what an African wild dog looks like. You can see it's not in great focus there, but it's a lot better than the 60 pixels and, you know, or animals that we made from this species, the Amur leopard. And I think it's really nicely done. So again, using different techniques to help us understand what these numbers mean. I think it's a really effective way. So the point is that when you think you've got a large number, this is another example of showing the sea level rise compared to a Reuters photographer. When you think you've got a large number, take some time and think about how you can make that meaningful to someone. And you could talk to your users. We've already identified that as a possibility of go and talk to your users, and they may have some ideas for you. Sometimes people like to use social math. You know, if you live in a city, you can say it's 5 times larger than, or it would fill this stadium 5 times over. You know, people may understand that. Another thing that I've been seeing lately is this notion of hand-drawn visuals. And this idea that you don't actually have to be digital when you're creating your visualization. I like this one. This is one that the Gates Foundation did, and it's not meant to be exact. But it's showing that if you're Bill and Melinda Gates, the mountains that you need to climb over, whether they're geographic or demographic or socioeconomic, they're not nearly as challenging as someone who's growing up, you know, a girl growing up in Africa. And the fact that this feels hand-drawn is really very useful. You know, that really makes a difference. I see someone adding in a question. They had to join late. Yes, we'll be sharing the recordings. I think they'll be sharing the recordings and
Absolutely.
the slides definitely. Yep. Yeah, so it'll all be available to you. And then also on this notion with illustrations, and again from the Gates Foundation, and I think I can show this to you, is Bill actually showing, you know, I'll let him talk. Hopefully you can hear him.
I don't know if you can hear him.
Okay, so the point is not so much what he's narrating this, but look at what he's doing. He's drawing a picture. It's a simple illustration, and we talked about in-person tactics to use in face-to-face settings. Seeing someone draw things is actually a very effective thing. This chart is far from exact, but he's making this point with visuals that he's drawing, and I'm seeing a fair bit more of this, and I think it's a very effective way of visualizing data. So, and again, you'll get all these links, so you can find this as well. So this is another example, making data relatable. And then this final example that I want to show, and then I'm going to share a few tools, is this idea of let's not forget to make data fun. So we're going to play a little bit of a data game together. Maybe you guys have seen this before. It's one the New York Times has done and repeated a few times. But they started it, I believe, with the opioid epidemic to try and explain how bad is drug overdoses. So let's play this game together. And they don't start with drug overdose deaths. And we should remember, by the way, that the New York Times, you know, you might have a topic that's very serious, as this topic is, but still you can turn it into a game, or if you want to call it an intellectual exercise. So let's start in, and maybe you guys can put in your chat box the answers to the question that I'll start with this question. The number of Americans who died every year from car accidents, we knew that it was 44,000 in 1990. Any guesses what it would be in 2016? Shout it out or put it into the group chat, either way. 35,000, so I'll go with that one. I'll draw, and all you're doing basically here in this one, the game part of this, is drawing it as a graph. Someone else put 38,000. Show me how I did, and then you can see the results. And what's clever about this, again, simple trend graph, we'll go on to the next one, but what's clever is because you are drawing it and then seeing the results, you're activating your mind. And sure, there's technology behind this, but you could do this as that chart kind of thing that Bill just drew. You could do this on a whiteboard. There's no reason you need the technology. Guns. Any guesses as for guns? Have they gone up? Gun deaths, I should say. Have gun deaths gone up or gone down? And by how? What do you think it would end with? Up. Someone says up, 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 up. 40,000. Why don't I do 40? I'll do a little bit more than 40,000. So we have a slight increase there. And interestingly, it's, well, it went down and then it went up, but it's kind of been stable, interestingly. So that's guns. We're getting close now to opioid. And I understand this is a crowd that understands that topic well, but we'll still play that part of the game. What about HIV? People probably will recognize that many people, that the number of deaths from HIV has gone down considerably. The question that I have for you is, what year around do you think it started to go down? So if you can type in the year that you think HIV deaths went down, you know, I'll go off of that. 2018, this only goes up to 2016 actually. 1998, okay. 2005 is middle 90s, 1999. Why don't we go with 19 90, I'll try and guess it about there, okay? And then we would start to see the dip. And I'll end it with 4,000. Went up a lot more, and it actually started to go down. It looks like that's about maybe 96, 97. Again, we're learning a lot because we're playing this game. I mean, they could have just showed this trend graph to us, but that wouldn't have had nearly the same impact. Finally, drug overdose deaths, 8,400 in 1990. Any guesses what it would be in 2016? I'll just show you quickly. I'll guess 45,000. And when I show this live, people will visibly gasp, or audibly gasp, I should say. They will, and someone typed in, wow. And again, this graph is much more impressive when you type it in, when you're playing the game. So these are games that you can play. There's actually a way that you can, there's a tool, which I can send you the link for, to do this. I want to end by just pointing out some tools that you can use for your work. You can use Excel, nothing wrong with that. You can use Google Sheets, but Infogram is a tool that I use a lot. And by the way, you can use Tableau and Power BI if you want as well. But these tools that I list here, especially Data Wrapper, Flourish, and Infogram, are very simple to use. They don't tend to cost a lot of money. LiveStory's advantage is that it's already consolidated a lot of public data, so it has an amazing data library. But these are some other tools that you can use. And I will end, and maybe I can even put in here my contact information. I'll put it in the chat box too, or my website. Reach out to me if you want these slides, you want to puzzle through ideas. There's a checklist that I have, and my website for more resources. So thank you so much. I love puzzling through and talking about all of these ideas with folks, so you're welcome to reach out whenever. And I'll turn it back to you, Daniel.
Thanks so much, Andy. This was great. You covered a lot of territory in a pretty short period of time, so thank you for sharing with your resources with us. I encourage you to continue engaging, and if you have some some papers that you've done or some white papers, feel free to add those to our link, right? There may be some great stuff that people want to read and pass along to their organizations. I'd also mention that at Sundays I said this here, that all the materials will be on the hub and all available. The recording will be there as well, and the PowerPoints. All that's really great, and it's something we all can use more often and more regularly. And I want to just call out again the visuals. This really reinforces our efforts on bringing your sort of visualizing thinking and the mural work that we've gotten a lot of positive response from. So if you're interested in that, you can also find a lot of that there for the visual learners amongst us, and putting those together in the galleries. The final thing I'll just say before we wrap up now is the next couple of weeks, and actually the next couple of months, we'll be soon posting a series, all the specifics of the webinar series. We plan to extend it out to right now, at least to the end of May. So we have a lot of different sessions coming up. We'll be having some series, and starting next week, we'll be focused on going back to our proof of concept that some folks on this call, many people on the hub have been participating in. Dave Walsh, who is leading it along with Eric John, a number of other folks are looking at how do we bring data together, how do we share it between health and human services from a pretty technical perspective. And next week we'll be actually sharing that. We'll be sharing a little bit more about we'll be sharing a little bit more about the actual technical connectivity and some of the really interesting work coming out of the Michigan Health Information Exchange and their interoperability land, which is really focused on fire, connecting fire and NEAM together. And then the conversation will continue actually into the following week, where we will kind of go even a deeper dive and bring some of the architects and some of the engineers who are really looking at making this proof of concept, which is bringing together all of these different pieces around how do you share information in a responsible, safe environment together. So those will be the next couple of weeks. And then, as I said, you'll be getting more information about a series of different things focused on social determinants, some other national initiatives that are happening, more technology kinds of things, some things on foster care, and a whole variety of things also involved with social determinants. So we are excited about the plan for the year, or at least the first half of the year. And as I said, you're all invited. Invite your friends as well. And you'll be able to find more and more on the website as we publish them over the next couple of weeks. We should have more information about the February, March, and then April ones out there. So with that, I want to thank you for presenting again, Andy, and taking the time to do that. And I encourage you all to actually, if you go and you put up a couple comments on the site, people can actually engage with you there as well if there's questions and discussion around this visualization stuff. Well, and I know we didn't have a lot of time to hear stories from other folks, but it might be interesting to hear other people's stories about how they've been effectively able to use data and information and kind of tricks of the trade that they've had with their friends, colleagues, and bosses and environments that they're operating in. So with that, I think we're at 1:30 here, and I look forward to seeing everybody next week on the call, and have a great weekend. So thanks for coming to the Let's Get Technical call.
Great. Thank you, Daniel.
Thanks, Daniel.
Okay, everybody.
Thank you, Andrew.
Sure.
Thanks, Al.